Last month, Liam experienced a first episode of psychosis. During an episode of psychosis, a person may experience disruption in their thoughts and perceptions, making it difficult for them to distinguish between what is real and what isn't. Having had past experience with a family member, Liam's sister noticed changes in Liam's behavior, which were the early signs of psychosis, and encouraged him to seek help. Within 72 hours, Liam was able to speak with a case manager at a prevention and early psychosis clinic, and they enrolled him in the PEP Montreal without a referral. Early intervention programs for psychosis offer interdisciplinary and comprehensive treatment. In addition to working with a case manager, a psychiatrist, and others, Liam also works with Clara, a peer support worker. 3 months after Liam started working with Clara, Clara tells Liam that PEP Montreal is one of many programs across the country, and that recently there have been efforts to develop a pan-Canadian early psychosis learning health system to implement evidence-based interventions for early psychosis in routine care settings. She tells him that if he chooses to, he can share his health data as part of the learning health system, as she decided to do. Since Liam is unfamiliar with learning health systems, he asks Clara what they consist of. A learning health system is used to gather data and information from diverse sources such as services, service users like Liam, families, clinicians, and researchers. The data is collected at multiple levels and is analyzed to inform treatment decisions and improve healthcare services. Data is then gathered again to determine if the treatment and services have in fact improved. Overall, a learning health system goes through multiple cycles of data-informed change in order to improve and innovate. After the indicators are identified, the data collected from different sources such as routine care, research, and quality improvement are transformed into knowledge. Liam's data is collected through the different services provided to him in the program. For example, data about the symptoms he is experiencing, the strategies he is using, the impact of medication are all collected from him every time he works with a case manager, a psychiatrist, and even Clara. This data is then stored in his electronic health record. Over time, the data collected will be transformed by the professionals he works with into knowledge, so that they can use it to provide him with an individualized treatment plan. The program also collects data from Liam regarding his experience receiving care. After every visit, Liam is asked to fill out a short digital survey asking him about his satisfaction with the visit and the program's services. The clinic uses this data from Liam and other patients to gather knowledge about the effectiveness and efficiency of the program's services. The knowledge generated from the data is then applied to clinical practice with the goal of improving healthcare services. Once the data is collected and put together and transformed into knowledge, it will be returned to the clinics and the providers. The clinics will then use the data to see how they are doing and to implement improvements to their services. The providers at the clinics can use the data to see how their patients like Liam are doing and make decisions on how to improve their services. In the final step, data is collected again to see if performance of healthcare services has changed or improved as a result of the data and knowledge collected. The health data gathered during each cycle is collected in a central storage system and tabulated so that different actors can derive new insights about diagnostic risk factors and best treatment approaches using the data. Liam understands that his data will be used to improve health and healthcare services in a learning health system, but he tells Clara he is worried about how his data will be used, stored, protected, and shared. As a general rule, patients need to consent to having their personal health information collected when receiving care. Custodians of that information must clearly indicate the purpose for which it was collected. As a condition of participating in PEP Montreal, Liam consented to having his data collected as part of his care, and to his data being used to improve clinical practice in the future. In Liam's case, this means that the data collected by PEP Montreal can only be used to generate knowledge for clinical practice in order to improve healthcare services. If PEP Montreal wants to use his data for any other purpose, it needs to seek his consent again. In learning health systems that involve more than one organization, data will be stored and accessed through a secure and centralized database. Before patient information can be added to the database, it needs to be anonymized. Clara explains to Liam that his data will be protected by a data governance council, with input from stakeholders in the learning health system, including patients, which will oversee and monitor the personal health information to ensure that it is being used correctly. In this database, the data is uploaded in real time or periodically to a central repository that can be accessed by all the actors in the learning health system. In the early psychosis learning health system, each clinic submits patient data to the central database on a monthly basis. Once the data is collected, the digital platform will automatically visualize the data and compare it to the data collected at other clinics. Liam will also be able to see how the Learning Health System project is doing, as data regarding the project will be posted on its website. Liam, as well as other participants, will be a key component in implementing the services that come out of the Learning Health System, so their feedback is always welcome after every visit.